But the flagship for the government was going to be the Accident and Emergency Department. They were going to expand it. They were going to reduce waiting times in accident emergency. And you have the CEO coming on television last August and telling Barbadians that the average waiting time in A&E had been reduced. And you know what? Unfortunately, there are people who reside and resided, because some of them are dead now, in this constituency, who have been to the Accident Emergency Department and have spent hours waiting to be seen and treated, and have deteriorated. And as I said, some of them have died, even last week. Even last week. There's a young man in this constituency who went to A&E department a Friday morning at 4 a.m. with a discomfort in his face. A discomfort, a funny feeling in his face. He was admitted, finally, from the A&E department the Saturday morning at 10 a.m. He went there the Friday at 4 a.m. and left A&E at 10 a.m. and he could not move his right side. And he lives here in this constituency. You read of cases of people spending hours. Last week, you read of a case of relatives are concerned, they spent 12 hours waiting at A&E. And we have a CEO boasting about a reduction in waiting times. Where? In the QH. If you go there now, you will see several people there who have been waiting for hours to be seen. And this was supposed to be the flagship. This was the area that they were going to deal with immediately. What nonsense. 3 years later, and people are still suffering and dying in the Accident Emergency Department of QH. And this government said that it would have been a thing of the past. Talk about deception. That is all it is. But try to be seen in the QH, and you're to be admitted. Try to get access to a lift to get from the QH to the ward. And you have one Irene Sandyford Garner, I don't know what is her title, if it is Minister of the QH, Minister of Lifts, or Parliamentary Secretary, had the temerity in the Senate 2 weeks ago to speak about all the lifts have been sorted out. Where? Where? 8 lifts in the QH, 4 working, 2 being tested, and 2 to be repaired. And she is going to get up in the Senate and say they're all working. Well, they say you can say anything sometimes. I don't know if she's a liar, but I know that all are not working. And they speak about the lab, and they acquire new equipment. And daily, they've acquired new equipment, and daily there are people waiting for vital tests because they're providing new equipment, but reagents are short. In short supply. So oftentimes you have to pay in the private sector to get these same results. X-ray department, still having problems in trying to get barium meals and barium enemas. If a doctor thinks you have a problem in your stomach, weeks before you can get when you might have to pay for it soon when I go into this later. And then we go to the medical wards. And the overcrowding continues. 3 years later, with a government that had a rescue the QH plan, that had all the answers, and you go on a medical ward daily, and you see people lying in the corridors. Nurses are stressed out, hence the high absenteeism. Bed sores occurring because there are too many patients for the nurses to deal with. Operating theaters, I spoke about that. Surgeries having to be postponed. And the recovery room is still overcrowded from time to time because of the inability to accommodate people who need to be in surgery intensive care, having to be there because the MICU is not open. But they're doing electrical upgrade. And they spoke about cost overruns. This was supposed to cost $8.5 million. And it is now estimated they're looking for a further $5.5 million because the new cost of this electrical upgrade is now $14 million. So it has moved from 8.5 to 14, and no one knows when it will be completed. So they are doing things. The Lions Eye Care Center, they have awarded to a new contractor. And we had bought equipment, air conditioning units for the Lions Eye Care Center before we demitted office. A new contractor, new equipment. The new cost is $5.5 million. That equipment will eventually go to the dump that we left there because it's a new contractor, new equipment. You know the bottom line. But you don't need to hear from me on these things. And I'm here this evening with a document, sir. It is called the Queen Elizabeth Hospital Program Budget Document for the financial year 2011 to 2012. 2011 to 2012. This outlines normally what has been achieved in the year preceding, what is the plans, and in terms of the expenditure. And I think that it is important that I take you through this document because this is the QEH speaking about itself. This is not me speaking about the QEH. This is the QEH. And of course, as I said, they speak about what they've achieved. They spoke about the electrical upgrade that I spoke about, how there's a cost overrun of about $5.5 million. They speak about a high dependency unit, how helpful it has been, before mentioning that it started in 2006. They work on it. They speak about buying dryers for the laundry, building cabinets for the pharmacy, buying 200 beds. They speak about lab equipment. They speak about the public washrooms downstairs, which were vandalized, that they are fixed. They spoke about, interestingly enough, they've expanded the capacity of the morgue. Now I think this is very serious. The morgue for a number of years had a capacity for 22 bodies, and they have now increased it to a capacity for 34. I find that extremely interesting. But I say no more on that. They have found it necessary to increase the morgue capacity. They speak about the cafeteria refurbishment, and they speak about maintenance contracts as achievements in a year. Of course, they don't speak about the C-arm that was ordered, the wrong was ordered, and they incurred an additional cost of $80,000, and the other pieces of equipment that have been ordered without reference to the specs and have had to be sent back to the suppliers at an additional cost. Those things are not mentioned, of course.